Fewer people went for health screenings last year compared to 2019 as medical services were deferred for COVID-19 needs. And the latest National Population Health Survey also showed that physical activity declined in the same period. Some 8,000 residents were interviewed for this survey from the mid of 2020 to 2021. Now, health screenings for chronic diseases fell from 66% in 2019 to 59% in 2021. The Health Ministry says it was a predicted trend, and that's because resources were redeployed away from non-urgent services. The prevalence of chronic diseases like high cholesterol was stable in recent years. However, the ministry is still urging caution as there could be a significant number of people who are going undetected. One family physician expects screening and diagnosis to pick up next year.
We're having an rapidly aging population, and the trend should have been an increasing chronic disease load, but yet we observe a plateau. We believe this is largely due to underdiagnosis because of lack of screening. But moving forwards, especially in the second half of 2022 and moving on to next year when we start Healthier SG, we think more patients will come forward to do screening, and the load of chronic disease should increase with time.
More people are also protecting themselves against diseases. Vaccination rates for influenza rose to nearly 19% last year compared to 2019's 17%. Meanwhile, pneumococcal jabs more than doubled to 22%. Fewer residents engaged in physical activities last year compared to the period before the pandemic. MOH says that's not surprising as social restrictions were in place. The daily commute to work or school was the biggest factor in getting people to stay active. The ministry will continue to expand exercise programs for Singaporeans. Now, the prevalence of daily smoking remained stable at 10.4% last year. Still, MOH is aiming to get more people to quit. While binge drinking was more common in the past decade, it dipped to just under 10% last year. The ministry will enhance education to target both habits. The survey also revealed more people were willing to seek help from mental health professionals. This went up by 10 percentage points after the pandemic hit, but fewer turned to informal support networks. Now, one psychologist says people may be worried about approaching friends and family, but these avenues should not be overlooked.
These would be the first social resource that we should be utilizing because they form that whole structure and that support for ourselves. It's when it starts to get a little bit more complex or you're a bit more confused and you can't make sense of certain things, or it starts to get a little bit more dire, so then we would encourage you to seek help with the professionals.
And speaking of mental health, a new tie-up aims to boost resilience in the community, especially among young people and the elderly. Sengkang General Hospital, Punggol West CCC and the Institute of Mental Health are joining hands towards this goal. It includes getting volunteers to raise awareness of mental health issues.
Now, joining us for more are Professor Hsu Pon Poh, Medical Board Chairman at Sengkang General Hospital, as well as Kitson Leonard Lee, Vice Chairman of the Punggol West Citizens Consultative Committee. Welcome, gentlemen. Professor Hsu, first to you. You could have partnered with anyone, but you chose to come together for this project. Tell us why, and how does this tie-up work on the ground? What do you hope to achieve?
Yes, the objective of these three-party collaborations is actually to promote awareness and better understanding of mental health care issues among the youth and elderly. Both youth and elderly are a risk group because both groups are not acutely aware of these mental health issues or not equipped with the skill set. So in Sengkang Punggol area, we do have this bimodal distribution of population, the younger one and the older one. So we want to help the community leaders to provide better support to our residents. Yeah, so there are three key approach has been identified. Number one is to provide training and professional support to our volunteer to champions, to ambassadors. 2 is to provide a tier approach system to the mental health management. 3 is a joint education platform to share with our residents, our volunteers, and so on and so forth. So it's all hands on deck approach.
All right, all hands on deck. Now, you are on the board of Sengkang Hospital. I take it if you look at what you just said, so you have a tiered system, you provide training, and you've got Sengkang Hospital, Institute of Mental Health, and of course, Punggol West Citizens Consultative Committee. You are the medical side of it, the more physical, clinical side as opposed to mental health. Exactly what is your role in this tripartite arrangement?
Yes, it is both of knowledge transfer into best practice and to positive impact upon the ground. As we understand, a mental illness or wellness is not like a physical signs and symptoms. Nothing can touch, and no X-ray can do that. So it really takes a lot of efforts and everybody involved to tackle this tremendous issue at least in Sengkang Punggol areas. Yeah.
Kitson, let's hear from you now. When you entered into this partnership, were you responding to a particular need that you saw in Punggol West? And also, how will the residents of Punggol West benefit from this?
Right. In fact, we have, in Punggol West alone, in the entire Punggol town, we all know that it's a fairly young town with young families. And within Punggol West itself, what we realize is that we have about 43% are youth, which means that they are below the age of 35. And at the same time, we have about 16% of our residents above the age of 55. So based on this, we realize that actually we have this very strong push. And because these younger families, they are also having, stress as well as anxieties. And we see a fair bit of this where we meet the residents and we talk to them. So that's the reason why we have this tie-up. And what we realize is that as the grassroots, where we approach our residents, where we knock on the doors, we are the front line. We get to meet the residents. Now, the challenge is that we may not be trained at the moment to identify families that need help. Hence, we decided that this will be a good partnership. And that is where Sengkang Health is able to train our grassroots volunteers, our champions, our ambassadors, so that we can at least help to identify, and refer them to clinical help if really needed.
All right,
that's how this whole thing came about.
Okay, correct me if I'm wrong, because I could have misheard you there. You said 43% are below the age of 35. Is that correct?
Yes, absolutely.
Yes. Okay, all right.
Within Punggol West itself.
So essentially, you're looking at training and you feel that this age group, especially if they are young families, they're young parents themselves, require a very different kind of focus if they have mental health issues. Is that so? So, yes. All right. So how have you worked together with Sengkang and the Mental Health Institute to provide for, according to you, how different is the approach to managing mental health for this age group? And specifically, how has this arrangement helped this particular age group?
But what we realize is that most of our youth in the schools, while we have school counselors, we recognize the fact that many may not want to approach their school counselors. Many of our youth may not also want to share their anxieties with their parents. And a lot of times they will turn to their peers. And hence we recognize that if we are able to arrest some of these issues much earlier, provide the training for our youth leaders, provide the training for our community volunteers, so that when we do our house visits, it is not just about financial assistance, but we are able to arrest some of, or even identify some of these early signs or early warning signs that may lead to maybe clinical interventions much later. But having said that, some may not even require clinical interventions. Maybe they just need a listening ear. They may just need someone to be there for them at the point in time. So one of the key differences is that we have Sengkang Health that's able to provide us with the training and the professional support, as what Professor Hsu has mentioned earlier on as well.
Well, the final question to Prof. Hsu, how do you know if this partnership has been successful? If I came to interview you in 5 years' time, what would you like that headline to be?
Yes, I would like to say that, I envision that the mental health of this region hopefully is the best in Singapore. We do see quite a little bit of youth or elderly needing help in our emergency departments and other departments. So hopefully I will see that kind of figures will decline in 3 to 5 years' time. And when we go to the residents and corporate populations, we'll see that a lot of elderly, a lot of adolescent with kids and coming out from the flats and all that to mingle with each other. Because due to last 3 years of COVID isolation and lockdown, I think that have also aggravated the anxiety, the depression among many residents. So I think it's timely for us to come together with IMH, with PA, with all the community leaders, all hands on deck approach to promote our population health, both in physical and mental wellness.
Oh, thanks so much for joining us today, Professor Hsu Pon Poh from Sengkang General Hospital and Kitson Leonard Lee from Punggol West CCC.